biggest problems is that we've tried to eat an elephant in one bite. It's just impossible. I think we need to take smaller steps to fix the problem. We were talking earlier in the back, how about tackle healthcare for children? Healthcare for all children. Smaller percent of the population, easier to manage, and then figure that out. And then from that experience, apply it going forward. But it's just too big of a monster to really try to say, okay, this is the fix for
it. We didn't road test any of this in a specific state to say, let's see how this works and try another piece of it in another state. Just let's change the whole healthcare system for 100% of the population to fix it for the 15% that wasn't covered. Okay, Dr. Reddy, what would you say, this is the prescription I'm going to write for healthcare in America?
Well, the bill that's out there now is definitely lacking some things, as we were talking about. One thing that I think is grossly lacking in this bill is any kind of tort reform. That's a huge problem in this country. This doesn't address it at all. That is one big thing. And then you're talking about all the time we spend in the emergency room, we take care of people that come in without insurance. And one thing that's not addressed, and this is not a popular thing to address in the government, are undocumented immigrants. They don't have access to care, and we take care of them for free, but at a very high acuity level. When you come to the emergency room, you're getting the most expensive care in our system. So we've got to do something about that. I wish doctors in the trenches like us and like you used to be were part of creating this legislation, and I really don't think that happened.
I don't think it did either. Dr. Boone, what would you do for calling in the fix?
Well, they should have talked to the doctors in Congress, because they were all screaming and they were trying to participate. And Congressman Tom Price is my congressman. I'm a very big fan of his. And his Empowering Patients First Act had a lot of solutions. And if I was to just be able to say, here's the one thing I want, it's selling insurance across state lines. Let's open up all the lines so that we can get less costly insurance, because they can compete. Right now it's selling insurance in Georgia, selling insurance in South Carolina. If everybody's competing, I think the prices will get better, and that's in his suggestions.
Let me just ask each of you, because our time is about gone, so just a yes or no. In 5 years, will Obamacare have made health care in this country better or worse?
I honestly don't know. I would say no change.
No change. Dr. Reddy?
Dr. Boone's the only one I've ever met that's actually read the bill, so I'd be curious to see what you say, but based on what I know, I think it's going to make it worse. The one thing that we want to preserve, I love being a doctor. I love my patients. You've got to be able to maintain your doctor-patient relationship, and I'm not sure this bill is going to do that.
Dr. Boone, final words.
I read the whole bill. It took me 19 hours, and it's going to crash the system and be the worst nightmare you can imagine. I'm absolutely certain of it, and I feel like her. I love my patients, and I left my family to come here to New York today because I want to keep my patients.
I hope you get to. Your patients are fortunate to have you. It just breaks my heart that doctors are leaving the profession after all the training and all the commitment and the dedication, not because they don't love medicine and not because they don't love their patients, because they can't make the business end of it work. And people have to understand, doctors aren't getting rich. If you think your doctor's getting rich, you're wrong. He's not. But I want him to. I want your doctor to be wealthy. Why? Because I want doctors to be thinking about treating me, not how they're going to make their car payment. So we've got to fix that. Got to make it work. Thank you all for being here. Really a pleasure to have you.